The main thing that I still notice is a balance problem. I don't like walking near a group of people because I need to be able to move my feet exactly where I want to put them. And also I am concerned about people jostling me and losing my balance that way. The other thing I have is actually quite poor memory. So I can easily, I can't go to the shops without a list, or having very carefully memorised a list of 5 items. I would have to write them down, is the best thing to do. And my memory, I know, because I've been tested, is actually much poorer than most people of my own age.
These days we've got tablets, they're called anticholinesterase medications, and the idea of these tablets is to slow down the progress of the condition. And as a general rule of thumb, the evidence is that these tablets slow down people from going into care for about 3 or 4 years, and that's not an insignificant amount of time in this group of people. And certainly this shows how research has brought about some real technological changes, and that produces meaningful and real importance to patients at ground level.
Joint Dementia Research, or its acronym JDR, is part of the National Institute for Health Research's desire to meet the dementia challenge for the UK, set by the UK government. It's really all about increasing the numbers and opportunity for people to be engaged in and participate in high quality research, both to understand the disease and have the opportunity to participate in those either observational or interventional trials that might in future change the course of the disease.
The future outlook really is a little bit on the grim side. I have been told that the particular type of dementia that I have is likely to lead to paralysis, wheelchair use, and complete loss of speech. And also the life expectancy from diagnosis is about 6 years.
Well, essentially there's lots of material, lots of publicity material out there to inform you as to how you might sign up. There's a website, there are leaflets, there are posters in most clinical areas that you'll find an increasing presence for. There's also the JDR website itself, where you can self-refer as an individual. And as an understanding, you don't actually have to have dementia to join Dementia Research, because the whole programme is as interested in healthy volunteers and carers or even staff who have an interest in the area, because the research agenda covers all such participants.
Paul has changed a lot. He used to be the most placid person, I mean really easy to live with, but he's become less placid now. Sometimes I hear him when he gets one of these nuisance phone calls, he actually shouts at them or swears at them. He would never have done that sort of thing before. So there has been that sort of change.
There's never any pressure on people to participate in a study. It's entirely voluntary, and you always have the opportunity to withdraw at any stage if you feel it's uncomfortable.
I think it's absolutely essential that we get people willing to cooperate to find out what the cause of this disease is. There's 850,000 people affected. It could be their relatives, their descendants, etc., who are benefiting from the research that is being done today. It's one of those things that takes quite a lot of time. I actually think the question is the wrong way round. I think the key question should be, why don't you? And that's what I would say.
And actually some of the things can be quite fun. For example, I do one that's called brain training, where you get to do all these little puzzles on the computer, and I really enjoy that, so you know, that's fun.
Essentially, it's all ages, all genders, all races.
We are in partnership with a number of other regional and national organisations, and we regularly sort of participate in research, and part of this research is about various different types of environments in terms of interventions. We also take part in some clinical trials, drug trials, and it's a part of a regular experience at Leicestershire Partnership Trust. I think we are, it's fair to say that we're one of the highest recruiters in the East Midlands to patients in dementia trials. So there's quite a bit that happens here.
So what's the situation if someone has dementia and they're incapable of signing themselves up?
In such circumstances, we would always check that people are able to sign up for themselves if they can, but if they can't, then there are procedures in place to allow for a carer, a relative, a next of kin, or someone responsible for their care, perhaps in a care home or a clinician, to sign them up to the register on their behalf. as it would be potentially in their best interests to be there. It's often found that people who participate in research actually have better health outcomes than those that don't. You can get not a higher standard of care, but an additional level of care that the research study in particular may be providing to you. You may get extra nursing sessions, you may get extra attention from members of the research team who themselves are clinically trained. That can't be guaranteed, but the advantages are really that these studies are approved by national bodies, they're approved and reviewed by ethics committees, so they're robust, they're done properly. And to an extent, there's a certain degree of altruism in that we're asking you to help future generations.
Though we know a lot more about dementia these days than what we used to know before, there's a lot of things that we still do not know, and there's a lot more variability still between different patients, and that can only be found out by trials. We still have a number of questions in terms of treatment efficacies, in terms of long-term prognosis, in terms of the pathway for different patients, and we will only be able to find that out if patients participate in trial. One of the particular groups, again, is the people who develop these conditions early, and there is quite limited information about these group of patients, and we here in Leicester Partnership Trust are involved in trials in early dementias. And again, these are the types of patients who are likely to benefit most by participation in research. So the message is this: there's quite a lot of research activity that happens here, and please do consider taking part in research, because you can contribute a lot of information to the patients and the sufferers in the longer term.
Do you think we'll ever reach a stage where we find a cure for dementia?
We're certainly on the journey, and what we have got now would have seemed unachievable several years ago, and who is to say that we may not have much far superior and more efficacious treatments in the future.
How are we going to find out how to treat people when there's so many people with dementia if we don't do research? I think it's ever so important.
Absolutely essential to make any progress at all. Don't leave it to other people.